It's Osteoarthritis week here at the Synergy Studio, and we are going to go through a mobility and strength routine that is specifically designed to help prevent the progression of both hip and knee osteoarthritis, so it can be used as a treatment method, and also just preventing things by keeping our joints healthy. Osteoarthritis used to be thought of as a wear and tear disease, but this is misleading. Recent research has shown that we need proper loading of our joints to promote optimal cartilage repair and regeneration. Let's start by moving through our hip mobility. You can use something for balance if you like. What we're going to try first is hip abduction, or moving our hip to the side. So I want you to slide one leg out while keeping your body long and your standing hips stable. Just learning what kind of mobility we have in our moving hip and how much stability we have in the standing leg. Today I'll take you through 3 of each movement. Let's try the other side. So I'm shifting my weight to one leg, trying not to let this hip come out, but stay strong and tall as my other leg moves. Testing my full range of motion through my hip. Your supporting knee can bend as you do these slides. So you could do this barefoot or maybe with one sock on. Good, now we're switching to hip extension or sliding backwards. So again, trying to stay tall. I'm going to see how far I can slide my leg back, keeping my spine long, and you can allow a little bit of bend in your standing leg. Making sure we're breathing, thinking of all of our alignment cues. Let's try the other leg. Sliding my leg back. This leg can bend. We're trying to keep the spine long, and we're staying stable as we do this. Next, we'll practice stepping forward. As you step forward, to have optimal loading through your lower body, you want a nice alignment through your hip and your knee and your ankle. You can choose just to step, if that's an appropriate exercise for you, or if you want to make it a little more challenging, you can lunge, really focusing on this knee alignment. Stepping back, alternating sides. Soft heel landing, both knees bend. We're promoting optimal joint loading through that front leg. Again, you can be choosing just a stepping pattern, or you can turn it into a lunge. Good, let's try 4 more. Stepping, option to lunge. Good, 1 more each side. Having muscle weakness or living a sedentary life can actually lead to OA because we need our muscle strength to provide shock absorption and good alignment through our joints. Good, take a little break. Next one, we're going to go through our full hip mobility. I'll show you from the back of the bar so you can really see my full movement. Here I'm standing strong on my one supporting leg. I'm going to circle this leg around through the front and see if I can circle around through the back. You can hold on to something for balance if you like. Circling around. Nice long and tall spine, strong, stable hip. If you have a knee OA and it's challenging to reach back, you might modify and not go quite as far in the back portion of the circle. Let's switch sides. Coming around the front of the circle, circling around, and reaching behind. Maybe you would like to try this in freestanding. You can use a countertop, back of the couch, the ballet bar you happen to have in your house. Last one. Good, and we'll take a little break there. Now we're going to add in some strength to our on this side, and I'm going to practice lifting out to the side and back. Seeing if I can keep my pelvis tall and stable. Again, you can hang on to something for balance, or maybe you're choosing to do this in freestanding. Good, you can breathe in as you move one way. Breathe out as you move the other. So this can be done with a resistance band as I'm demonstrating. You could also try having your standing foot on an unstable surface, like our balance block, if you wanted to add a little bit of difficulty there. Good, keep going, switch sides. You can stick with the band, or if you want to see what the balance block version would look like, both are great options. Here I'm standing and sliding, but I've added some difficulty to my standing leg. So I'm loading that now on an unstable surface. Or maybe we're just working along through the band. Let's try two more. You can see I have a little more movement through my standing hip on this side. The unstable surface does make quite a big difference. Let's try loading our knee at lots of different angles. So we're going to practice a star stepping pattern. This time we're stepping forward with our right leg. Again, you can step or incorporate a lunge into your movement. Step back, step forward on an angle, option to add a little lunge. Step back. Step to the side, option to add a little lunge. Good, we'll step back angle, maybe a little lunge, and then we'll step straight back. Maybe a little lunge. Good, other side. So starting by stepping forward, holding it here, or lunging in good alignment with our knees. Forward on an angle. Just loading that knee joint through lots of different movements. Sideways, back angle, and then straight back. I love practicing stepping straight back because that's often where we lose our balance. It's good to practice. Next up, we're going to practice going up and over a step. At home, you can use a yoga block, a big textbook that you no longer use, anything that just gives you a little bit of a surface. So the step up is our concentric. We're working on our good alignment through our hip, knee, and ankle. We're going to step up, stabilizing through this leg, and then as we lower down, that's our eccentric lowering, and then reset. You can spin around, or you can just step back around your block. Other side, stepping up. Strong supporting hip and glute, working up, controlled step over and through. As you lower down, the heel of the foot on the block can lift. Good. Let's try two more each side, alternate what you're working on. This is more of a movement pattern, so we're training ourselves as we ascend or descend stairs, that we have really great alignment through all the joints of our lower body to minimize abnormal loading. Good. Nice long spine, we're lifted in our sternum, lowering with control, stepping back. Let's try one more on each side. Stepping up with control, moving through, lowering with control, pelvis stays level. Last one. This is quite a bit of balance. If you're too unstable, just make sure you have something close by to hold on to. Excellent. Take a little break there. Last, we're going to move through some squats. Squats can be really helpful, getting up out of chairs, doing a lot of functional activities. Here I'm using the bar. At home you can squat in freestanding too. We want to think about hinging at both our hips and our knees, and keeping a nice neutral spine as we squat. Let's take a breath in. You can keep a little chin tap. Breathe out and squeeze your glutes and come up. So at any time you can use something for balance, keep going, or you can do this in freestanding. So as we're squatting, both my hips and my knees are moving. You can have your arms in close, or you can have them reaching forward and then coming up. So it is a glute exercise, but we're working on the alignment through our lower body as well. Good, so again, as we're squatting, we're thinking, where in space are my knees and my ankles? Can I promote optimal alignment and loading through these joints? Breathing in. Breathing out. Good, let's try 4 more. Often when we have joint pain, we'll be hesitant to participate in physical activity, but we know that muscle weakness contributes as a risk factor to OA, so we really want to make sure we keep our lower body strong. Last one. Excellent. Take a little break. Thanks for joining me and Mr. Bones today for our standing osteoarthritis workout. I hope it keeps you strong and well aligned.